Hello everyone, my name is Martine Hackett and I'm a Special Assistant Professor at Hofstra University in the Master of Public Health program. We're going to take questions at the end of the webinar and you can type them in on the right hand of your screen. It's my pleasure to speak to you today about a topic that's familiar to all of us, communicating about health. We've all had conversations with our family, friends, doctors, and ourselves about how we're feeling on a regular basis. Even when we meet someone for the first time, how are you is often the first question that we ask. In today's webinar, I'll be presenting some of the dramatic changes that have been taking place in the last few years to in this basic human interaction. Today's presentation will examine the current landscape of social and mobile media and how these new technologies are being used by patients, providers, and public health professionals to provide care, to connect, and to communicate. I will also address some of the challenges that these tools present for us in our relationship with our health and our healthcare providers. I'll end with my take on the possibilities and potential that these technological advances provide for improving population health outcomes. But first, a few definitions and numbers to orient ourselves. One of the most important advances in communication technology that's occurred within the last few years is the development of Web 2.0. Web 2.0 means that communication patterns are shifting from being unidirectional and passive, which was the main feature of Web 1.0, to active and participatory. Web 2.0 offers social media applications that facilitate user-generated content and peer-to-peer interaction. So what does the landscape of Web 2.0 and health look like in the United States? Surveys routinely find that 3/4 of U.S. adults use the Internet, and about 80% of those online say that they use the Internet to look for health or medical information. 25% of U.S. adults participated in Web 2.0 in 2011 and about their health or the health of others. And although studies continue to show that ethnic minorities and those who are older, less educated, and less healthy are more likely to be non-internet users, a more nuanced picture of this digital divide is beginning to emerge. The use of social networking sites does not appear to differ significantly by race, ethnicity, or social group. And once online, differences disappear, especially when mobile phone usage is factored in. So, what is MHealth? In early 2012, the largest medical organization in the United States, Kaiser Permanente, released an Android app that allowed its 9 million members to access the information in their medical records and to communicate with their healthcare provider. The availability of this information technology put power into the patient's hand, and this intimate, interactive approach has been called the new norm for healthcare. This is an example of the explosion in what is known as MHealth, or mobile health, which is, according to the 2010 MHealth Summit from the National Institute of Health, is the delivery of healthcare services via mobile communication devices. MHealth also includes text messaging, remote patient monitoring, and health apps. A 2012 Pew Internet Life survey found that 46% of Americans own a smartphone of some kind, up 11% from the year before, which has fueled the explosive growth in MHealth apps. And according to Juniper Research, over 44 million downloads of health-related apps are expected this year and is predicted to quadruple by 2016. Thousands of new developers have been drawn to this medical mobile app world, looking to cash in on this growing market. So, how exactly are social media sites used for health, and how is MHealth being used by patients? At its most basic level, people post questions, comment on other posts, create content, and connect with others with similar diseases or health conditions. So here's a couple of examples. This social networking site, Patients Like Me, enables its members to share condition, treatment, and symptom information in order to monitor health. So this is a social networking site where those who are members can exchange information about how to deal with their chronic conditions and build a database of information about how to best treat these conditions. 2 Diabetes is another social networking site for people with type 1 and type 2 diabetes to connect with each other and to learn how to cope with this chronic disease. And there are many different ways that people use this site to be able, again, to get support for each other. Social networking sites like these support a movement that's known as participatory medicine, where networked e-patients shift from being mere passengers to responsible drivers of their health, and where providers can encourage and value them as full partners. People living with chronic and rare conditions are more likely to be e-patients and benefit from this peer support and taking control of their health care. MHealth apps are being used by consumers to monitor health-related lifestyle issues like their diet, daily caloric intake, exercise, to track their pregnancies and monitor their moods. They're also downloading apps for chronic disease management that provide medication reminders, monitor blood pressure, and sugar levels. These apps, with data stored on your device or in the cloud, can provide long-term trends in patients' healthcare status and can be shared with other users. So here we see the idea that these apps can be brought to your smartphone and provide you with a way to track information about your health, your lifestyle, and in order to be able to use it for yourself or to share it with others. How effective these MHealth apps are for improving consumer health outcomes is not clear. And there have been concerns raised that many may not deliver as promised, leaving consumers confused. Although previous studies have found that tracking what you eat and drink can help with weight loss, mobile devices definitely make this easier and more accessible. Behavioral coaching and setting weight loss and fitness goals within a social network can also help to maintain accountability and motivation. Currently, the Food and Drug Administration is drafting guidelines for regulating mobile medical apps as medical devices. So here we're seeing with the proliferation of these mobile health apps, especially ones that are working more as medical devices, like being able to monitor blood pressure and to send it to your physician, that these are acting more as medical devices. And so here we see sort of a gray area for regulation that's rapidly changing. So, how are social media and apps being used by healthcare providers? Healthcare providers are faced with a rapidly changing relationship to social media and mobile technologies. On one hand, for hospitals, having an interactive social media presence is almost an expected way to communicate with the public and their patients. And some providers are using the opportunities provided by Web 2.0 to establish themselves as experts in their field and to embrace the interactive components of social media. So here we see an example of doctors who have signed up on Twitter to be available for you to follow them and who will happily share advice and information along with you. Recent surveys have found that 80% of physicians use mobile devices at work. Many clinicians are benefiting from near instant access to medical information about drug interactions, disease diagnosis, and access to current medical literature in their daily work. For instance, Medscape Mobile was the #1 downloaded free medical app in 2010, and this is an app which allows them to look up hundreds of thousands of journal articles to get the most recent information about caring for patients. And social media sites like Sermo also put providers in contact with their peers who are in similar specialties or dealing with similar types of patients. So professionally, Web 2.0 and mobile apps can provide advantages of access, openness, and connection. However, many healthcare providers are confused about the appropriate relationship for them to have with their patients in a Web 2.0 world. Is it reasonable to friend your patient on Facebook or to follow them on Twitter? Through these venues, there is the possibility of establishing deeper relationships between patients and providers and to extend care beyond the exam room. But what are the ethical obligations of providers to comment on health-related issues that are brought up via social media? Of course, privacy issues are also a concern when providers and patients communicate via social media, and professional guidelines are needed to establish these boundaries. So how are social media and apps being used for public health? Public health officials, seeing where people are going for their health information, have also jumped into the social media pool, an MHealth pool, to communicate their health promotion messages and to gather important data. So here's an example from social media that's being used by the Centers for Disease Control and Prevention, which is the National Center for Public Health in the United States. Some other examples are local public health departments using social media sites to promote their services and education. YouTube allows for sharing videos and health messages to the public. So here's another example from the CDC and their YouTube channel where they are uploading their recent anti-smoking campaign, and it also provides a place to comment. Let's see, Twitter is also a great way for followers to be aware of what public health is and how it promotes health. So here's an example for the American Public Health Association and their Twitter page. The CDC and other organizations are using smartphones currently for disease surveillance in developing countries around the world. So the idea is that not only are these mobile applications useful for passing along information, but also for gathering information and data as well, being able to benefit from its these mobile technologies. Some of the challenges, however, for public health professionals in using social media are the need to keep information up to date and accurate. Also, social media do not work like traditional media in that people are waiting to be targeted with helpful information. Social media consists of communities that are actively involved with reacting to and interpreting what comes across their screens. So for public health professionals, people who in a social media realm challenge or question public health recommendations need to be addressed in a way that doesn't alienate the public or cause them to lose trust in public health officials. This is definitely a new arena for public health as government agencies, and guidelines for what to present and how to respond to the public are emerging. So I would argue that this is definitely an area of public health that is right on the edge in terms of how do we communicate to people via social media that looks at the new relationships between people and not as sort of a top-down exchange of information, but more of a peer-to-peer sharing of information. And this, again, is challenges the traditional model for public health and public health communication. So, what are the challenges? To summarize the challenges posed by these rapid developments in social media and MHealth apps for patients, providers, and public health are certainly the ethical concerns with patient-provider communication via social media, including issues of privacy and the boundaries of professional domains. And again, this is an emerging issue not only in public health, but between patients and providers as we have information that's being stored and shared in different ways that are more open, more public, and also go beyond the exam room. Also, another challenge is certainly being able to address underserved populations. The poor, the elderly, the disabled are all challenged by issues of access to computer, access to Web 2.0, and access to mobile technology. We know that these populations often have worse health outcomes than those who are more advantaged. And there's question of whether or not these new technologies can even widen this gap further. Also, these populations and others are challenged by health literacy issues and the ability to understand and interpret health information that uses these new technologies. So even though information might be printed or out on a computer screen, the ability for audiences to interpret and understand what's being communicated to them can also be a question. Finally, we know that consumers need safe and reliable, trustworthy apps and social media sites to help guide their health and what they're looking for and their ability to deal and manage with their chronic diseases. So certainly the question of how do you know which site to trust is important. So what's the potential for all of this on the horizon for the use of social media and MHealth apps to improve health outcomes on the population level? There's great potential. Certainly the potential is the use of peer-to-peer exchange of information can reduce cultural misinterpretations of health promotion messages. So the idea is when we sort of focus on peers, talking to peers via social media about diabetes or about a chronic illness, we can say that perhaps there are fewer barriers than if a physician is talking to a patient. That patients who are going through similar conditions from similar cultural backgrounds are able to communicate in a way where misinterpretations, and especially cultural misinterpretations, can be reduced. We also know that there's a potential to communicate with those with lower literacy levels by using video and audio. So the ability to freely share or to more easily access videos through YouTube offer a potential for people with low health literacy to understand what it is that they need to do for their medication compliance, for instance. So to be able for people to see and to hear in a different venue through different types of media also offer the potential to improve health literacy and to improve compliance. Also, some of the potentials of social media and MHealth in public health is the idea of providing patients with a more active role in their health care. So by having patients that are communicating to each other, whether they share a common condition or a rare condition, they now have the ability to have more active participation in their care because they have information about what other patients are doing or what other physicians are doing. And they can then bring this information into with their doctors to discuss and to be able to have more control. So it's less of a passive participation with patients who are connected to social media. Certainly for providers, providing faster access that's accurate and medically appropriate information is a great advantage to social media. The fact that providers have to rely less on their memory and more on other sources that are verified can help with their care for patients, and also provide a sense of security, knowing that providers are up to date with the latest treatment options. Also, public health potential with MHealth and social media are the ability for public health providers to communicate and interact with the public wherever they are. So it's this idea that now with social media and MHealth apps that public health professionals can tailor messages, can focus on smaller groups and populations without at low cost to be able to communicate messages in a way that gets information across, but also that allows for responses. So I would argue that this is another way that I see a really big potential for public health, the ability for public health professionals to hear what the public has to say about these recommendations, to answer their questions directly, and also to be aware of where there are barriers in the information that's being communicated. So we're going to be taking questions in a minute. And if you'd like to find out more about how public health can improve population health outcomes, the new Hofstra Master of Public Health program, in partnership with experts from North Shore LIJ Health System, is going to be providing an interdisciplinary training for the next generation of public health professionals. So for more information on the program, please go to our website and contact our program director. Thanks so much for listening. I also have some references for you guys if you wanted to take a look, and some resources from some of the data that I presented. Okay, I think we'll start with some questions. Okay, let's see, I'm getting the questions in here. Okay, the first question is, How safe is the personal information that I put into health-related apps? Well, this certainly brings up the question about privacy and issues of any information, right, that you put on social media or that you enter into your computer. And I would say that many of the same guidelines would apply that you would need to be concerned of as similarly if you were purchasing something online. So I would say looking for verification that these sites are secure, especially if you are going to be entering in or accessing your personal health information, to make sure that it's actually going through the official site and not some sort of copy is important to verify that this information is going to the people who you think it's going to. But I think also too that there needs to be concern that the information that's put on social media is out there. I mean, whether or not you are on sort of a more private discussion board certainly can help with those concerns. But for the most part, when we post something on Facebook or on Twitter, it really is out there for most people to be able to see. So I would argue that to caution if you are concerned about those sort of privacy issues. But on the other hand, for some people, sharing the information of what they're going through about their health is the point. To be able to say, this is what I'm going through right now, I'm taking this medication, here are my side effects, and other people responding to it is part of the reason why social media is such a great advantage. So I would say caution with personal information that you don't want to get out there, and embrace the issues of what makes social media so great. Okay. Second question, should I send my doctor a friend request on Facebook? I would say if you are interested in being friends with your doctor and you see that they're on Facebook, perhaps, but don't necessarily expect a response. Again, as I mentioned in the webinar, the American Medical Association is developing guidelines for how physicians are to interact with patients in social media. And again, the similar sorts of interaction rules apply as they would to in person. So again, if your doctor is someone who happens to be a personal friend or related to somebody you know and you would invite them to dinner, then I think that having a relationship that's through social media is appropriate. And similarly, I think if a doctor, if your physician or caregiver is putting themselves out there through social media, either through Twitter or Facebook, then to follow them or to friend them is appropriate because this is the venue that they're placing themselves under. But I would say that there should be concern whether or not you want to carry over your relationship that you have with your physician into the social media world. And at the end of the day, you can always ask your doctor and not be offended if they don't friend you back. Okay, next question is, how is social media affected by the Affordable Care Act and its related changes to health reform? So this is an interesting question that brings together sorts of lots of rapid changes that are happening around health and public health. As we all know, the Affordable Care Act is in process now, and it will be for the foreseeable future. And the Affordable Care Act, in addition to some of the provisions that we're more familiar with regarding the individual mandate to get health insurance, lots of provisions within the Affordable Care Act also have to do with prevention and public health and have to do with health information technology. More specifically, there are funds in the Affordable Care Act to have electronic health records for hospitals to improve their electronic health records system. And so what electronic health records, the sort of issues that opens up is not only does that make it easier for hospitals and providers to have access to your information electronically, but depending on where the hospital wants to sort of put that information, whether it's like Kaiser Permanente to make it an app or to make it sort of more widely available, certainly brings up issues that we mentioned before about privacy and access, especially for those who are don't have access to a computer or don't have a smartphone. But again, the Affordable Care Act certainly is focusing on ideas of how to improve and to reduce costs for health care. And much of the data does show that having sort of a more streamlined approach that does, and by using whether it's telehealth or sort of remote monitoring of patients, or the idea of accessing people being able to care beyond the exam room, can help to reduce costs. And another thing I would say too in terms of prevention and social media, and especially with mobile health apps, are some of the apps that I mentioned before about monitoring your weight, or your caloric intake. These types of apps, again, have been found to be helpful in aiding with weight loss. And so when we're looking at issues of obesity, which of course is a huge public health issue, the ability for these, for social media and these mobile health devices will be more and more useful and helpful in reducing these issues in the future. So I see a big future for the connection between the Affordable Care Act and social media and MHealth. Okay, the next question is, what should I do if I get conflicting advice about my health condition from social media and my doctor? Well, I think that this definitely is something that's most likely going to happen. If you are on social media and, again, going back to the example of diabetes, you are looking for what other people have gone through, ways that other people have treated their conditions. This might differ from what your doctor is telling you about how to treat your condition. And certainly we all know too that if you do a Google search for weight loss or for diabetes, you're going to get a wide array of information, and not all of it is going to be the most accurate or appropriate medical information. And so I think, again, similar guidelines apply. One of the things I would say is to consider the source, to be able to look to see where this information is coming from. Again, people are seeing that social media are where interested health patients are going. You have pharmaceutical industries that are either creating social media sites or certainly populating these social media sites with folks who want to promote that sort of message. And I think that that's something to be concerned about, or to certainly be aware of, that there are people who might be contributing to these social media sites that may not be just like you and may have a certain point of view that they want to promote for a certain reason. So I would say always question what you do see or read about on social media, and not just do it because you see it. I think also too the idea is if you are starting to see something that you really are becoming convinced that is a possible treatment option for you, I think bringing it to your physician is completely reasonable, especially if you can do it with some of the evidence or the ability to say, like, here's why I think that this is a treatment option for me. Before when I talked about the Patients Like Me site and also this concept of participatory medicine, that's really the point. The point of participatory medicine is to say, I'm not a passive patient that's just going to do whatever my doctor tells me. I'm going to be an active participant in my health care, and in doing that, I'm going to look for information on my own. I'm going to talk to other people, and I might challenge what my physician tells me. And so I think to be able to understand that and to embrace that is part of what these changes that we're talking about. And so at the end, I think it's about trying to get the best information possible, but also to be in a dialogue when possible with your healthcare provider. All right, I think that that is it. We're wrapping it up here, and thank you so much for listening. I really, really appreciate it. And again, if you have any other questions or would like to contact me, this is my email, and you can also reach me on Twitter.